I'm very pleased to have been invited to offer a Meet the Experts session at this meeting on the topic of how I use molecular genetics and mutations in AML. I've been interested, as I speak with some of the delegates here at the Congress, to see some of the differences in the UK and in Europe versus the United States. So I'm expecting an interesting session about how we actually apply molecular genetics in the diagnosis and prognosis and treatment of AML. Usually in the United States, it's the standard of care to order FLT3, NPM1 and CEBP as a minimum for molecular genetic assessment, but I have to say it's become quite standard to order multi-gene, sometimes 50 or even 200 gene panels. I think from a treatment perspective, currently FLT3 actually does guide treatment. There are FLT3 inhibitors available, as well as for younger patients, there is certainly a bias for allogeneic stem cell transplantation in first remission. For NPM1, isolated NPM1 mutations, often there is a decision not to go forward with stem cell transplant, but this is controversial. And of course, there is an exciting area of molecular monitoring of NPM1, or quantitative monitoring, which is not yet standard, but a recent paper in the New England Journal of Medicine suggests that monitoring these patients might soon become a way to prognosticate and also to guide therapy, hopefully in the not too distant future. CEBP double mutation patients are often not offered allotransplant in first remission, which is why this is part of the standard of care of analysis, but this is becoming very interesting field as we realize what happens down the road to some of the CEBP double mutated patients, and also as we point out some of the familial predispositions that this and other mutations are shown to have. So I think it's a very exciting field. I think that clearly the IDH mutations are becoming very interesting in clinical trials, not yet standard of care, but we really believe that testing of IDH mutations probably will become quite standard down the road. And I think that, again, the differences in practice between what's evaluated in the US versus around the world is quite striking, and we'll have to wait and see what becomes worldwide standard.